I'm going to spend a little bit of time talking about the 10-year plan and reading from my briefing. And then I'm going to go a bit more me. So you'll probably enjoy the second bit more than the first. And then leave plenty of time for questions. So I'm new to I'm not an NHS lifer, and I'm not a Department of Health and Social Care lifer, and that is a big, it means that you're a sort of slightly different creature when you come into this amazing world of the NHS and health and social care. And I was brought in to try and, I think, bring that, the end of the telescope that is about citizens and system leadership, about working together and getting things to work when they're on the ground in places, rather than the expertise around particular policies that we have lots of people working on. It's been a fantastic privilege to work with Richard and others in the Yorkshire and Humber Innovation Network. We've done some fantastic stuff over the years. This city is such an amazing place for health and social care, going right back to Thackeray, and fast forward into the assets we have, whether that's in the hospital trust and the other community and mental health trusts in the city, the really a council that's really committed to collaboration and health and well-being, and sees that one of the best ways to help people come out of poverty is to give them the most healthy lifestyle, and a fantastic private sector with EMIS, TPP, fantastic manufacturing companies that have come out of this part of the world because you had this cluster of brilliant clinicians who wanted to do things differently. Baroness Judith Blake, who's now a minister in the Lords, who was leader of the council when I was chief exec, her dad was one of the people who pioneered kidney dialysis out of Leeds. So there's like this heritage to the city, which is amazing. And then the universities, of course, which are a brilliant place for innovation to happen. And if you can get those different parts working together, then the sky's the limit, really. The famous triple helix approach. We tried to do that in Leeds. I think we've made a lot of success, and it's been done more generally in Yorkshire. That wasn't in my briefing, so I better get back to my briefing. 5 big bets on innovation in the 10-year health plan. Data to deliver impact. This is our chance. We have such a comparative advantage if we get this right and we do it in a way that patients and citizens have confidence in terms of the use of anonymised and scaled data in a single data set. That's probably one of the best reflections of the diversity of the world at the moment in terms of the fantastic diversity of our population. So real opportunities there. AI to drive patient power and productivity. The famous doctor in your pocket, as Wes would call it. Genomics and predictive analysis for preemptive personalised care. Starting at birth. Really interesting debates that we had about that during the production of the 10-year plan. I was one of those people who was saying, do you think people really want to know about everything from that age? And there's a really interesting set of moral questions about this, but I think in terms of particular specialist interventions that can happen for rare diseases, for example, it must be the right way to move forward. Wearables to make care real time, and then robotics to support precision. And then some great exciting initiatives for the future around global institutes, regional health innovation zones, the research environment and innovative medicines, and also quite thoughtful stuff around regulators that maybe some people missed, where we've realised that MHRA and NICE, getting aligned, getting the processes ready for the digital age, which they're not quite there yet, I think, in this space, is something that we're really, really keen to do as well. And we know how that drives, the ability of people to adopt and scale really, really significantly. And the move to a single national formulary for medicines, which I didn't know what the word formulary meant before I did this job. Again, is one of those things that sounds quite technical, but I'm well informed. Been argued to me very strongly. This is really, really important. We're doing lots, so I'm gonna do the second part of what I'm going to talk about, actually based on Phil's 3 areas that you mentioned, because in terms of productivity and the UK, you know, this is what we've got to do is turn. I mean, I've been on the receiving end of the NHS taking a larger and larger share of public spending, because I've managed Leeds Council through 14 years of various elements of austerity, and you know, we've got to stop that incessant, you know, eating up of the proportion of the cake. There's that productivity issue. The only way you're going to do that is to get the NHS up and out, and to work in partnership, to work in systems, to get things to actually happen. And I think one of the things that we felt through the production of the 10-year plan, and we had lots of debates. I was often in the room with, Wes called it the Milburn-Riordan axis, because Alan Milburn is you'll know, an amazing, talented ex-Secretary of State, really wise, experienced voice, very much from the, the best, the greatest hits is coming out at the moment, the league tables, the performance and oversight, the singularity of being really clear about what you want from people in terms of electives and GP access and UEC performance, the money, that's really, really important. And I was usually the one saying, that's fine, but it's not 2001. We've had austerity, we've had COVID, we've had Brexit, we've had all these changes. It's a different world. It's a more complex world now. How do we help make systems be able to do those things without it feeling like you're just going through a stovepipe down from the centre and people are having to operate in splendid isolation to achieve them? Because if you look behind all those targets, then the key to them is not the NHS and the big acute trust operating on its own. Of course, some of it is, and it's got to be really, really good at that, but a lot of it is how, in productivity terms, we connect with people much better. We have human-centred approaches to public services. We think about that in terms of where people live and where they work, the idea of neighbourhood health, where we can shift health almost back to where it started in terms of how we can, just get that community-based approach to how people are living their lives and give them more agency in terms of their own health as well. And then obviously the need for partnership in making that happen. So moving on to Phil's second point, I'll just run through a few things that we're doing at the moment. Going back to my briefing, we're really trying hard to build stronger commercial strategic partnerships in the department and in the NHS. And there's a group of people who are working really hard to make that happen. And it's manifesting itself in different ways at the moment. So the Colgate partnership around toothbrushing, Colgate Palmolive partnership around supervised toothbrushing. I thought the reaction to that has been really interesting for me. I've owned public health in the council for many years. I thought it was the best decision of the last 20 years actually to bring that back into local government where it started almost, and back to be able to influence the wider social determinants of health. But there would have been a reaction, I think, 10 years ago, very different to that toothbrushing partnership, because people would have said, some people did say this, well, shouldn't the parents just do it? But anyone who works in a school or works in the health system and comes across a lot of young kids at the moment will know that some of the biggest problems come from dental issues. And so I think having a partnership like that that's going to reach up to 600,000 children each year is incredibly powerful. And one of those low cost, no cost options that I try to talk to my colleagues in the department and in the NHS about, instead of this feeling that I think everybody's been a bit hardwired into, which is if it's new, we need more money, we've got to layer it on top of what we do already, rather than what a lot of other sectors have had to do much more over the years, which is there's a new issue, how are we going to reprioritise, what are we going to stop doing or do a bit less of, how can it link to something else? As a critical friend, the NHS has not been good at that, and that's what we've got to get better at. there's some really interesting stuff coming out around intellectual property guidelines for those of you who are interested in that side of the house, and that hasn't been reviewed for about 15 years or more, and that is going to be really important, I think, in again trying to make it easier and clearer for organisations who are providing and commissioning services to manage IP strategically, and making sure innovations benefit the NHS and the public by securing what are valuable assets rather than just letting them shoot out into the private sector without any attachment back to where they started. And so look out for that, and I think Health Innovation Networks are going to be involved in the regional launch of all of that. So that's one to look out for. And the Health Data Research Service, really, really fascinating. I think what an opportunity that is, but what high stakes there are in that. As we know, in the past we've misstepped. If you go wrong with the public on this, it's the sort of you set back by a decade. So we've been really, really careful in thinking that through and trying to get to a position where it's a really safe and trusted way of working, but also one in which researchers and partnership can plug and play into is going to be really, really important. And then other things that will come as well. I just wanted to finish by talking about adoption. I would also, I mean, you've heard from Jim earlier, and I can't, I won't sort of repeat what Jim said, because he's the expert on all of that. And I think the great thing about having someone like Jim at the top table is that he's very pragmatic. He's very experienced in what does and doesn't work, and he's somebody who really wants to change the system. And so, yeah, I won't add to that, but I just wanted to maybe finish before opening up for questions by talking about that triple helix, that industrial partnership. So I was the one who wrote the first cheque for public money for the Advanced Manufacturing Park in Sheffield. And for those of you who don't know, that was an original partnership between Boeing and the academics in Sheffield University who were experts in metal cutting. And they were trying to look at how they could utilise that for future composites and different developments of the aerospace industry. And it was a massive leap of faith. I don't think it would have happened today, actually. And it was one of those where if it had gone wrong, you probably wouldn't see me here. I'd be on the, I'd be in Wikipedia somewhere as the person who signed away wasted £10 million. But it's had more visits than I think any installation that I know of. McLaren, Boeing, Rolls-Royce. It's such a fantastic example of how to get it right in terms of that partnership space. And for me, that is all about finding a bit of the Venn diagram where commercially you've got to find something that works for the private sector. You can't expect the private sector to just subsidise and do everything on the terms of central government or the NHS all the time. You've got to utilise the great flair and focus and agility that the private sector's got. Then you've got to bring in the clinical, in our terms, the clinical specialist expertise of the NHS and that amazing, amazing bit of, expertise, experience that actually the NHS brand in global terms for any business is like gold dust, really, and we don't make enough of that. So being part of a really gold standard partnership makes huge sense for the private sector, and they should put something back because of that. But then, crucially, these things happen in places, and I was talking to colleagues from Greater Manchester earlier. There are some fantastic things going on around the country, and including, not just in Leeds. I'm able to say that in my new job. It was obviously always in Leeds in my old job. But I think that is where the real opportunity is, because if you can do that in a way that taps into the asset base that's different in each place, then that is powerful. And you also get the mayors behind it. You get that ability for people to see, back to Phil's point about productivity, that people are going to get jobs from this. You know, they're going to get better healthcare. They're going to live longer. Those things are so important. And yeah, I'll finish just by saying, I think Leslie was here earlier on the women's health agenda, and I've seen, you know, I've learned so much in the last year, and some of the issues we've got to get right on the women's health agenda are massive, and Leslie put it really well in her report about things like the gynecology waiting list. If you look at the number of people who are on that who don't actually need secondary elective surgery, but are having to wait and hold their lives up because of that. Surely there's better ways of us dealing with issues like that. And then I was just reading some work that's been done on men's health before I came here, and 61.5 is the average age of for men of healthy working life, healthy life. You know, when they're living their healthy life, bit of their life. You know, what a waste that is for people, and what a strain that's putting on the system. So yeah, we've got to make this about people and places, and definitely about the people who need our help the most as well, the poorest. We've got to help them improve their health the fastest. So I'll finish there, and hopefully I've left a little bit of time for questions, Phil.
Thanks, Tom. That was brilliant. So we've got roving mics, just like this morning. So I think I've got a lady here on my left who'd like to ask the first question. If you can just tell us who you are and where you're from.
Yeah, hi, my name is Maya and I work for Teva UK. My question, and some really great points in that presentation, Tom, great to hear. In terms of adoption, I agree completely with everything that you've said, but how do you at the department ensure that you're staying close to all parts of the system, including the life sciences, when you're thinking about policies and moving through with them, to ensure that you understand our world so that there aren't any unintended consequences? I mean, I've had examples where I've spoken to colleagues, for example, from NICE through our trade body, and some of the assumptions made, I don't think are necessarily always checked with the sector. And you go ahead and you think you're doing the best thing for all parties involved, but how do you actually make sure that you are listening to the people on the ground who are then having to be part of that adoption? Thank you.
Yeah, I absolutely see what you're saying. I mean, I've worked with the private sector for like 25 years now. I used to be 6'10" and full head of hair, and I love working with the private sector because, as I say, they bring such a focus and a drive to things. But actually, it's great working with the public. It can be great working with the public sector as well if you get it right, because the public sector brings a mandate in terms of democracy and in terms of the ability to get other bits of the system working in the same direction. I think we're quite a way off that at the moment in terms of that partnership. It feels like we're a bit stuck. I won't mention the dreaded acronym that begins with V that some of you will be aware of. But having talked to some CEOs in the life sciences sector, I really have a desire. I've been trying to talk to the department officials and ministers about this. I've talked to Wes about it, about how we can. I think part of our relationship will always be slightly transactional, because it has to be, because of it's about public money, it's about transparency, it's about contractual issues. But there's a big part of it that needs to be strategic as well. And I think the space that you're talking about is where we can get better at having that two-way flow of expertise and information, because I think one of the things the civil service does is moves people around, and so you lose that institutional memory quite quickly. There's also, I think, more we could do to improve the commercial expertise that exists within Whitehall, and that is changing actually at the moment, and that is the work that I talked about is led by some people who've had great careers in the private sector who are now in the system and usually come to me wringing their hands about the bureaucracy. So you've got good advocates within the system now. But yeah, I think we've got to get better at what you've just articulated, and yeah, I'm sure there are ways that we can.
Okay, I don't want to lose this opportunity to have Tom. We've got time for maybe one more question. Okay, gentleman over there.
Hi, Andy Bleeden from the Global Health Connector. I'm interested to understand how we can raise our eyes outside of the UK and think about how do other people do this, you know, whether it's in Europe or Africa or in the US. How are they doing this issue about public-private partnerships? And what are we doing to sort of try and learn more about them?
Yeah, so I went on a, this was before I was in Whitehall actually, but I participated in a programme with MIT in Boston, and Boston, Massachusetts, not Lincolnshire. And with no disrespect to anyone from Boston, Lincolnshire, and it was a regional cities innovation program basically. So we spent 2 years working with Sydney, Oslo, Monterey, Kentucky on basically how to make your economy more innovative, and we majored on health when we were there. And it was fascinating in terms of the differences. I think Scandinavia is where I would say we can learn most. I think there's lots that the Danish system is doing, for example, which I think is making a real difference. But you know, it's something that I think we've got to utilise the universities for as well, because often the universities have those global links already. And I think it's one of my great regrets that we haven't come out of Brexit realising that one of our big windows to the world is universities. And so building the partnerships that we've got around them and linking up to the knowledge and expertise they've got, I think is really important. And you know, the private sector as well, the big companies operate globally and they have that knowledge and expertise. So yeah, I think some of it is in our own country. I do think the advanced manufacturing park, I think some of the things that we do in health innovation are absolutely will stack up in terms of what's happening around the world. But I think we can get better. The States are much better at finance. They're much better at not relying on the bank of mum and dad for entrepreneurship. And I think that's where we suffer a lot. We don't think about our finance system in as the fourth bit of the helix, which is what we learnt on the MIT work. So yeah, they're the ones I would say.